Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Welcome to Your Spine. I'm Dr. Don, and this is all about your spine, your health. This week, we're actually going to give it a little twist to it. It's about your child's spine and their health. Now today, we're going to talk about the 10th thoracic vertebrae, or T10. It may also be called dorsal. It's just another word for thoracic. The 10th thoracic vertebrae, as we tell you in each segment, has a vertebrae above it. In this case, it's T9, and the vertebrae below T10, naturally, is T11. The problem that we have with childhood is that under the age of 5, 6, or 7, when a child complains about pain, if there's nothing bleeding, broken, or swollen, we generally pat them on the head and say, don't worry about it, it'll go away. Or how about that other one? It's called growing pains. That says that you're supposed to have pain as you grow. Not necessarily true, not very logical, in fact. So what should you be aware of in the event that a child has a back problem? Well, first of all, how might this occur? Remember, a child has a spine, it's softer and more flexible than an adult's. But look at the lifestyle of a child. Would you be possibly being as active as children are with running, with games, with falling? How about that first bicycle they learned to ride and tipped over? Do you have a function that is the same as that? Believe me, if it happens, you know, and you can identify loss of movement, you can complain about sore muscles, and you have some knowledge about your body that tells you, gee, this part of me isn't working. So remember, the problem with children is that they don't have all the communication skills. Sometimes we just dismiss what they're telling us in favor of looking for something bleeding or broken, and back problems don't present that. And children also, if you want to watch their patterns, 2 patterns to watch include behavior. So if you see a behavior change that you can't explain for some other reason, pay more attention to that child. And the other one is the same as adults have. They simply won't move quite as easily. There'll be a restriction of movement, or you may observe that some of their physical patterns of lifestyle have changed. And don't forget, children are in cars too as passengers in car crashes. So as a parent, you should pay attention to these things. If you're unsure of what's happening, just pick up the phone, ask your family chiropractor for information or advice. For more information on the topics that we've discussed today and at any other time, go to our website, www.bcchiro.com. There you'll find information on the association side about exercise, lifestyles, and preventions. Remember, your back is important to your daily health. Join me on the next show as we continue our journey down your spine.